see a copy of it after it's finished on Facebook Live as well, or on Facebook, our Facebook page. So I'm going to go ahead and turn this over to Dr. M and just give her permission. Okay, go ahead, Dr. M. The floor is yours. Thank you.
Okay, and also these reports are always put on our website under COVID, under reports. And today we're going to give you the summary of the trends that Vince Campo puts together, and I put together also the summary of the breakthrough cases. So as you can see, the past month where the cases are going down, the number of cases going down, the 7-day rolling average is going down, and the CAR score is kind of hovering around 25 for the past month. And the last, I believe it was 134 cases yesterday, but the average has been about 130 cases in the past 2 weeks. There's the positivity rate. We're starting to see a decrease in the number of tests being performed. It's now less than 1,000 per day, but we have the same positivity rate. So there's still cases out there. We're still in a surge, but it is decreasing. And as you can see, the death count has gone down, and the cases, the number of hospitalized cases has gone down, but the ICU has remained fairly steady throughout the month. But we are seeing a decrease in deaths and decrease in hospitalizations, COVID. Our fully vaccinated proportion is continuing to go up, and our breakthrough cases are remaining fairly steady. And but the bulk of the cases still are among the unvaccinated. And by the way, this only includes the civilian data on the proportion vaccinated, it's just civilians, not the DOD numbers. The JIC reports the DOD numbers. Now, I've had several requests for people to give details on these breakthrough cases. So, since we started vaccinating back in December of 2020, from February 7th to the 7th of October, there have been not quite 3,000 quote unquote breakthrough cases, 2,859, who are people who are fully vaccinated and subsequently test positive. Most were Pfizer, followed by Moderna, Johnson & Johnson, and 2.3%, we just don't know because the DOD doesn't give us that level of detail. Approximately half are male and female. The majority have occurred, the breakthrough cases, among those 18 to 39 and those 40 to 49. If you recall from previous reports, these are the same groups that are the main source of cases during this surge. In addition, there was about 15% in the 60 to 74 age group, 4.3, 12 to 17, and 3.6 among those 75 or older. The previous report detailed this. Vince did a whole analysis on this and looked at the median and all of that. So you can take a look at that in the report. And if you look at the total number of people vaccinated as of the 1st of August, the breakthrough cases actually constitute a very small proportion of the total number vaccinated. There's a higher proportion among the deaths at about 13%, but of all those who are fully vaccinated and died, all of them had multiple severe comorbidities. The other big news this week that we actually reported on Friday, the 8th, that we've been observing these kinds of trends in increasing numbers of breakthrough cases and increasing numbers of asymptomatic cases compared to prior to the surge. And what we found out last Friday was we now have evidence that Delta has been circulating on Guam. The sequencing result came in on the 8th, and out of the 67 samples that we sent to the CDC, there were samples taken from the 25th of July to the 10th of August. 59 or 88% were Delta or its variants. And finally, to look at age, as you can see, all the age groups are starting to converge. We're still seeing these high numbers in the working age population, the people who are out and about, people with kids, et cetera. But these other groups are starting to decrease, and there's actually been a lower number among the 12 to 17, which could correlate to those groups becoming more fully vaccinated. Okay. That's it for this week. Any questions?
Right. Thank you, Dr. Ann. So we'll go ahead and move to the question and answer portion. So far, I've only had Polly and Joe submit their information. So I'll go ahead and start with Polly Suba with K57. You can go ahead and, and I apologize, I didn't state that we're doing one round of questions, two questions each. Thank you. Go ahead, Polly.
Holiday, Dr. Ann. I have a question about the breakthrough cases. Just so we have a clarification, there is concern in the community that we're seeing breakthrough cases more so. According to the CAR score, looks like 26 fully vaccinated, are hospitalized. Can you just confirm that this has nothing to do with temperature, the vaccinations being in a proper facility as far as temperature is concerned, that the efficacy rate is not being lowered because they're not being properly stored?
No, I don't think so. The immunization branch has these massive freezers that were shipped here just for Pfizer, which has to be kept at a certain temperature. I don't think that's the issue. Again, I think we need to stop obsessing about breakthrough cases. Delta is here. It's been here at least since July. We had a few cases prior to that. I think it's because of Delta. It's more infectious. It's more serious, but we're not seeing, and we did see a lot of hospitalizations and a lot of deaths during this surge, but most of those people were unvaccinated who died, okay? Only 13% were fully vaccinated, and they all had severe comorbid conditions. So the vaccine seems to be working despite the fact that we have so many cases in the community. And the whole point of the vaccine now is herd protection, not necessarily herd immunity. So we still have to keep beefing up that immunization rate and have people get their boosters. I don't think it's a storage issue. I really don't.
Understood. And then if we can, the data as far as, because our population is, where are we at? We're at 86% population that can qualify for being fully vaccinated.
I don't have the exact number in front of me, but yes, it's at least more than 80%.
Okay, and then so if you can just confirm with us that just seeing the number of breakthroughs it is more so about the high percentage of population that is vaccinated. Well, again, the pattern that we're seeing is the 18 to 39 and the 40 to 59 group. Those are the group that's the majority of the cases. That's also the group that's the majority of the breakthroughs. So it could be that it's because these people are out and about and they're more likely to be working or in groups. And the elderly, we're not seeing that because more of them are vaccinated, and they might also be just having more restrictive behaviors. Maybe they're scared of COVID. I would be if I was elderly. And Annette David may want to just weigh in on this. Dr. David?
Sure. Hi, Polly. I think you raised some good points. I think I'll start by saying that, in fact, we should expect breakthroughs to happen. And why is that? Number one, no vaccine is 100% effective. And as you vaccinate more people, you will also see growing numbers of breakthroughs. It's just the mathematics. So I think, number one, as Dr. Ann said, we shouldn't obsess about the breakthrough infections because they are expected to happen. So I kind of like to liken vaccination to like an umbrella, right? So you use an umbrella to protect you from the rain. When it's a drizzle, when the community transmission is low, you tend to be very protected by the umbrella. But when you're out in a typhoon, when the community transmission is very high, you will still get wet. And so you need additional layers of protection, which would be your masking and social distancing and all that. But we should expect breakthroughs to happen. The idea is that infection in and of itself might not be the right indicator to be focusing on, because what we really want to focus on is the hospitalization, the ones with severe disease, and the ones who are dying from COVID. And if you look at those numbers, the risk for the unvaccinated is many times higher than that for the vaccinated. I think one issue is that we're looking at just absolute counts of cases, just how many cases are vaccinated versus unvaccinated, when in fact we should be factoring in the denominator to those numbers. So when you see the JIC report and it says 26 people in the hospital are vaccinated versus 34 who are unvaccinated, those are just absolute numbers. They're not grounded in their denominators, when you should actually be looking at 26 over how many people are vaccinated, which is a huge number, and then that 34 who are unvaccinated in the hospital, you need to look at that, fetter that to the number who are unvaccinated, which is smaller. So it's a way of how the data is presented, but very clearly what we need to look at are the hospitalization risk and the mortality risk.
Thank you. I'll wait for the next round. I'll wait for the next round. Thank you so much.
Thank you, Polly. As I mentioned, we only have one round for today, so thank you, Polly. Next, we'll go to Joe Taitino from PDN.
Morning, Dr. Ann, Dr. David, and everybody. One thing that I'm sort of wondering about is, as we're moving along, I know we're kind of shifting from talking about herd immunity to herd protection, but as the weeks go by and we're having more and more people who are unvaccinated kind of driving the number of COVID cases, one thing I'm wondering, is there any thought being given to, is there any effect there with having so many people who don't have the vaccine, and, a number of people that do have it also getting infected? Is that going to be driving up immunity as we kind of move forward into the future? And is that possibly going to offer any additional protection? Just kind of wondering how to think about this as we move along, with more and more people having a bigger percentage of the population having caught the virus already.
It could have some effect, but we don't know how long the immunity lasts. It could be only a few months. So it might be that people who have become infected and recovered will also need shots in the future. This might become like a flu shot. We're going to always need boosters for it, especially if you have chronic conditions or, there's a waning of the immunity over time. So
yeah,
it's possible.
Joe, it also shows us that there are three populations we're concerned with, right? One would be those people who are still ineligible for the vaccine, basically are young people who are under the age of 12 because they haven't approved the vaccine for children yet. And then you have the group that is eligible but has chosen not to get vaccinated. But you also have a third group, those who were vaccinated early on in the year, whose immunity may now be waning and who will need boosters. So that really indicates three key strategies for vaccination. One is, as soon as the vaccine for children comes out, we have to be ready to immediately roll out that in that population. And then second is to really work harder to try and persuade those who are still unvaccinated but eligible to get the vaccine. But also thirdly, it's to ramp up the booster shots for those who had the vaccine early on in the year whose immunity may be going down.
And on that point about the booster shots, I know Delta is, it may not be as effective as preventing Delta. And I know we keep saying we shouldn't kind of obsess over, well, first of all, I'm wondering, Is there any increase with the booster shot? Any evidence for that in preventing the Delta variant? But also, I know you keep saying that we shouldn't obsess over the breakthrough cases, but if we still have, around 50% of people that are kind of driving, the spread, I know even people who are vaccinated, it's something like 13%, but, our most vulnerable population, if there's still, is it not something to still be concerned about if, the folks who are really sick are still getting COVID and dying, and they're still, as we kind of approach 100% vaccination rate, there's still some portion of the population that's going to be vulnerable to getting COVID and dying, regardless.
Yeah, absolutely. I mean, I was having a dialogue with Jason and Chris and Sabrina this morning, and Chris was asking, so when is this going to end? And the answer to that, in short, is when the virus runs out of susceptible people to infect, when the pandemic will end. And so that's why it's so critical to get as many eligible people vaccinated as soon as possible. So I hope that answers your question. I mean, right now, although we can be very happy about the fact that 72% of our total population is vaccinated, that still leaves about 30% of the population that's either ineligible because of age or medical conditions, or because of choice, who are not vaccinated. And that's almost 50,000 people. That's a lot of people for the virus to continue to wreak havoc with.
Right. And there's always going to be risk for something like this. People keep forgetting this is a pandemic. This is kind of unprecedented. So this is a unique situation that we're learning about as we move forward. And there's always going to be risk, especially if you're elderly and if you have numerous chronic conditions. Those are the risk and vulnerable groups. And as Dr. David said, the kids, we still have to protect the kids. There's no vaccine for the kids under 12. So we're still pushing for vaccinations. I want to see 99.9%.
I'm sorry. So does that kind of mean that we're going to, COVID's like our third leading cause of death? Are we just going to kind of have to learn to deal with that, for especially like among our older and, multiple comorbidities folks?
Well, what we're seeing with yes, COVID, it was the third leading cause of death on Guam in 2020. It was also in the U.S. And it's right now scheduled to be the number 3 for 2021. So it's above stroke, which is normally number 3s. So, yes. But I think that will decrease as people, as the virus changes. It all depends on what happens with the virus. If new variants emerge, et cetera, et cetera. So I really think we're moving towards, this might be something you have to get a twice-a-year shot for. You get your flu shot, and then you get your coronavirus shot, and then 6 months later you might have to get, and it's just like flu. It's gonna change. Viruses evolve and change. So they might have to do like the flu shot every year. The people at the CDC get together and they see what strains are going around, and that's how they determine the flu shot. It's going to be very similar to that. The COVID shot will probably be, tweaked every year for the next, I don't know how long. We don't know.
And we shouldn't just accept that, Joe, which is why we're doing things like this outreach. We have to keep pushing that message to get the vaccine and to continue with the masking, the social distancing, and the hand hygiene. Unfortunately, we don't have a magic bullet right now that would instantly remove the pandemic. It's about staying the course and doing the proven interventions that we know work.
Thank you, Joe. Next is
All right,
Oya.
thank you.
You're welcome. Next is Oya from Guam Daily Post.
Good morning, everyone. So first question relates a little bit to the population we were just talking about, our children. Can you tell me, Dr. Ann, how many children age 11 and below have had COVID? How many were hospitalized, and what was the range of their severity?
Off the top of my head, I don't have that. I believe we did a special report in one of the earlier reports on the kids and who was being affected. There has been only one case of what is known as multi-inflammatory syndrome in children due to COVID, and that was a fairly recent case. So there have been a few children that have died, but mostly those were severely disabled children who also got COVID. I don't have the numbers off the top of my head. You might want to check the previous reports, but I can get that for you. Send me an email.
Okay.
But it hasn't been as, children and younger people just aren't as susceptible, except for perhaps if you have a severe disability, or, you know, that's almost like being severely old or having comorbidities usually. Okay, so most kids recover. Most people who get this and they're younger recover. Even if you look at the deaths, in the last report we showed a histogram where it showed the deaths by age, and you can see it's all skewing towards people over 50. So young people don't really get severe, they just don't. A few do, but again, there's always risk.
Okay. Thanks, Doc. Secondly, you know, we've been watching the rankings worldwide, and Guam has been close to the top of the nation in infection rates per 100,000 people. The New York Times reported on October 13, I believe, that our island is only behind Alaska on this area. So why are our infections much higher than other states and territories, especially considering our rate of vaccination?
I don't know. It could be because of the high rates of chronic diseases. We have high rates of diabetes and obesity, and it could be that people are more susceptible. You know, we don't have, everybody drives. You know, we don't have the island isn't very conducive to walking or exercising, except for, of course, the beaches, but everybody drives around, right? That's the one thing I noticed about coming back here after living here and being in Hawaii, where I biked and I walked almost everywhere. I mean, these are things we need to think about because our obesity and diabetes rates are higher than the U.S. So that could be driving it. It's not just Guam, it's the entire Pacific has a epidemic of diabetes and obesity. I don't know the answer 100%. Dr. David, you want to weigh in?
Yeah. This is, it takes me back to a public health class. Oya, you asked a really good question. And I think to be able to understand that there's two things we need to think of. One, even if we have high rates of vaccination, we still have close to 50,000 people here in Guam who have not been vaccinated and are therefore at risk for infection. But also, secondly, in epidemiology, you know, when we talk about disease, we always look at three things, right? We call it the epidemiologic triad. It's you look at the agent of the disease, you look at the host, and you look at the environment. So let's look at it from that perspective. So in terms of the agent, the change really happened with the Delta variant becoming very predominant because the Delta variant is much more aggressive, it's more transmissible, and it tends to cause more severe disease. The other thing the Delta variant appears to be doing is that the waning of immunity from vaccinations appears to be a little bit faster with the Delta variant. So that's an interesting thing. What about the host? People on Guam? Well, what we know from the work we've been doing in the Epi work group is that the rates of comorbidities are much higher here in Guam as compared to the US. We've just looked at some of these indicators for the community health assessment that public health was doing, and the rates of obesity, of diabetes, of cardiovascular and pulmonary disease are higher here in Guam. And so as a whole, our people probably are not as immunocompetent as the populations you would compare with in the US. So we do know that. And then the environment. We are doing a lot of testing here in Guam, although the number of tests is now starting to go down. At one point, we were doing about 1,500 tests a day. That's about 1% of our population. We were testing 1% of our population every day. I don't think you'll find that in many places in the world. And so when you test more, you will find more, including the asymptomatic cases. So that, I think, think explains it. And then also in terms of the home environment, our transmission patterns here in Guam, they seem to indicate transmission happening in families, in the homes. And if you look at the data in terms of density of people living inside homes, there are more people per house here in Guam as compared to the US. And so you put all these things together, and it's not surprising that we are seeing we are still seeing this high rate of this relatively high rate of new cases, despite the fact that we are doing okay for vaccinations. So the key message there is we have to push more, we have to vaccinate more, and we have to also emphasize that we can't let down our guard.
Thank you, Docs.
Thank you, Oya. Next is Daniel Perez with KUAM.
Good morning, Dr. Ann and Dr. David. So just one question. Do you think that a 2-week lockdown would help curb this surge?
Probably
No,
not.
And
Probably not.
I'll tell you why, Daniel. Lockdowns are good early on in an epidemic when the background rate of community transmission is not high. At this point in time, what would you lock down? If the transmissions are happening in families, how would you lock that down? So at this point in the epidemic, with our high rates of community transmission, it really falls on vaccination and social distancing and mask wearing, the usual interventions that we know work. That's what we have to just keep promoting, keep advocating for.
Thank you so much, Dr. David.
Do you have any follow-up questions, Daniel?
No, that's it. Thank you, Janella.
Okay, thank you, Daniel. Next is Jerry Partido with PNC.
Yes, and related to what Daniel asked, is it true also that because there's no more lockdown, right, that the more people who get infected and survive that, they develop more antibodies, right? That's a step also in the right direction, right? Because if the majority of the people here get immunized either through vaccination or natural antibodies because of infection, that will stand a stronger chance of, kicking the virus off the island entirely. Is that a true statement to make?
Well, Jerry, go ahead, Ann. Go ahead.
I was going to say yes and no. If we've had 16,000 cases and we have a population of about 168,000 people, that's only about 10%. Okay, and estimates of the proportion fully vaccinated range from about 72 to about 82%, depending on whether you count the military numbers or not, and the civilian and the total proportion vaccinated. So we're still not at 95 or 99%. So, and it's possible, but again, we do not know how long that immunity lasts. It could be 3 months, it could be 4 months. We don't know how long the immunity lasts for the infection. It's just like, because the virus, again, we're back to the virus evolves and changes. Look how influenza changes. You need a different shot every year because different strains circulate. Same thing probably with coronavirus. We also don't know what's ahead of us. We are just getting through this surge. We're starting to see a decrease. We're just getting through Delta. We don't know what's going to happen next.
So, Jerry, if I understand your question, what you're asking is, isn't it also okay for people to get sick and infected because then they develop the antibodies? That's what I heard you say. So am I right? Was that what you were asking?
Yes.
Okay.
Yes, some quarters are saying that, right? Some Scandinavian countries are. You know the literature about that, I'm sure.
Well, Jerry, here's the thing. If you do it that way and you allow people to be infected, you don't know who among those people will die and who will survive. So that's a very unethical way of achieving immunity. So it goes back to your question the previous week, right, about herd immunity. Herd immunity is really just a description of a phenomenon that happens with vaccination. It should never be used as a public health strategy, particularly when you have vaccines that are effective, that will help you develop the immunity without getting you infected. So this is an issue of ethical behavior also, and that would be my response to that. If we have a safe and effective way to protect people without them getting infected and therefore not exposing them to the potential of having severe disease and long-term effects or possibly death, then we should go with the safe and effective way, which is vaccination.
Okay. My last question is the former Physicians Advisory Group chairman has said that Guam's breakthrough rate is extraordinarily high when compared to the mainland and even internationally. Do you agree with that? He's even inviting CDC officials to make a case study of Guam because he's saying that there's something unique about the breakthrough cases in here. What's your comment on that?
I don't think so. We've also already analyzed the breakthrough cases. We don't need a special study, I don't think. We are very comparable to what's going on. The problem that I've seen, especially with the deaths, is we saw during this Delta surge, a lot. 2/3 of the deaths in the past couple of months have been dead on arrival, most of whom were unvaccinated people. That I think was unprecedented. But our hospitalizations, we seem to have come through this with the hospital hasn't been, it's still clogged up in the ICU, but we did not see what we saw earlier prior to the vaccinations. And that's in the August 31st report. You can take a look at that data, what the hospital and the ICU looked like during our surge last fall compared to now. And the ICU was much, much higher. So we're seeing the protective effect of vaccines, and I don't think our breakthrough cases are abnormally disproportionate compared to the U.S. They're seeing a lot of breakthroughs too. It's Delta. It's Delta that's driving these breakthroughs because so many people are asymptomatic now. You can see that in the report as well. When you look at, May, June, July, we saw more symptomatic cases. Now it's more asymptomatic cases. That's a characteristic of Delta. People might not even know they have it and they can still infect other people.
Yeah, and Jerry, I would say, in fact, if you have a good understanding of vaccine dynamics, breakthroughs are expected. They're expected. The more you vaccinate, the higher the degree of your population is vaccinated, then the more cases of breakthrough you will expect. I think that's just mathematics. What do I mean? Well, if you recall, like when they made seatbelts into law, after that came into effect and more people were using seatbelts, then majority of all the motor vehicle accidents were in drivers wearing seatbelts. Does that mean it was unusual? No. It was just that there were more people wearing seatbelts to begin with. The important thing there was the fatalities from the motor vehicle accidents went down. So there's a parallel with this COVID pandemic. As we vaccinate more people, more breakthroughs will happen. But what you need to look at is not the breakthrough infection as much as who is getting hospitalized, because that's going to affect your healthcare system, and who's dying. And when you take a look at those indicators, it is still happening predominantly in the unvaccinated. So I don't think there's anything unusual about the breakthroughs. It's to be expected with vaccine dynamics.
Okay, thank you.
Thank you, Jerry. And I do see Jason Salas here with the link. Did you want to ask a question, Jason? Okay, I'll move on. I know you wanted to sneak in one more question, so go ahead.
Thank you. Most of the fatalities we've seen are unvaccinated, right? Is there a fear? And we're trying to figure out what the reason is behind this. Is there a fear of the vaccine amongst people in that age group, or are they wanting to get vaccinated, but they just can't because they're bedridden and rely on others to get access to the vaccination?
Most of the people who are in, I don't know about bedridden at home, but we've had deliberate outreach to not just St. Dominic's, but to homebound elders for outreach for vaccination and testing. So I don't think it's that. I think it could be lack of knowledge. It could be lack of transportation. I really don't know. Sometimes you have people who don't want to take the vaccine. Maybe it could be, I think, lack of knowledge and health education. So we're still trying to combat that in the entire community, not the unvaccinated. Yeah, it could be what they're getting off social media, or I don't need that because I don't feel anything right now. I have no idea.
And the elderly have the highest or have the best vaccination rates in our population. Is that right?
Actually, it's higher among those up to age 74, age 60 to 74, and then there's actually a drop off in the 75 plus group. I don't know why. If you look at the vaccination rates by age, they're lower in the elder. I'm not sure why.
Yeah, so it could be access, but then also, Oya, keep in mind that just being elderly is a high risk for severe COVID and for dying from COVID. So just by age alone, that already puts them at a high risk category.
Thank you, Oya.
Thank you.
And one more question from Joe Taito.
Real quick, we keep hearing that, interhousehold spread is kind of what's driving a lot of these infections. I'm just curious, can we get like an idea? Is there a percentage, the amount of it, and sort of the other locations where people are typically catching COVID, the workplace, out in public? I guess, Dr. Ann, that would be a question for you.
What is the question exactly?
I'm just curious. We keep hearing that the majority of people are catching COVID or the Delta now inside of their homes. What does that number actually look like versus how many people are getting it maybe out in the community?
You can actually see that on the sit rep that's produced weekly. If you want the actual numbers, it's updated every Friday. And it'll give you the proportion from households, proportion from workplaces, and in healthcare. And if Vince Campo is on, he could maybe answer that. I don't see him.
Okay, you know what? I'll go ahead and take a look at that. I appreciate it.
And then we do have one question from a media outlet that's not in attendance. It's we just want to know, based on this, whether, and I think this is for Dr. Ann, you have a suspicion that one of the batches of vaccines from 4 to 6 months ago maybe was bad for whatever reason, and whether people need to get revaccinated.
I think we've had good infrastructure put in place for storage of the vaccines, and I don't think we had a bad batch. I think it's waning immunity. If you saw that 2/3 of the breakthrough cases were Pfizer, it might be that, some people got vaccinated in January, December, January, February. It's now 8 months later. So it might be that the vaccine, what we saw with the breakthroughs was the median for the number of days ended up being 140 something days, which is about 4.5 months. So it could be that the vaccine only is good for 4 months and then you need your booster, or 6 months. Again, it's probably going to end up like flu, where we need to have boosters, every year just for COVID and for flu. And don't forget your pneumonia shot. If you have elderly relatives, they need that too.
All right. Thank you, Dr. Ann. So that wraps up our press briefing data with Dr. Ann. Thank you also, Dr. David, for joining us today, and to all of our media members. I do have Dr. Ann's presentation from today. I'll go ahead and share that with all of our media members via email. So that'll do it for this week. Next week again, the time and day, or sorry, the day of the week and the time may change, but I will remind everybody of that next week as well. So that'll do it for this week. Thank you again, everyone. Have a great rest of the week.
Recording stop.